Hello, and welcome to the latest video from Adolescent Medicine Consulting. I am Dr. Mira Bihari, a pediatrician and board-certified adolescent medicine specialist with over 20 years of experience caring for teens, tweens, and young adults. I started Adolescent Medicine Consulting to help physicians and other healthcare team members learn more about adolescent medicine so we can all help teens live happier, healthier lives. These videos are one of the many services we offer. Please check out our website, www.adolescentmedicineconsulting.com, and send us a message for more information about how we can help you help teens. Now, let's jump to the video. As a reminder, these videos are for informational and educational purposes only. They are not a substitute for your own clinical judgment and are not a medical consultation. If you have a specific concern or question, please reach out to us directly through our website, adolescentmedicineconsulting.com, or send us a message through the platform that you're watching the video on. As we continue the series on what to do when, going through the classic adolescent psychosocial SSHADESS assessment, we arrive at the optional third S. Depending on who you speak with in the field, this S is either for sleep, social media, spirituality. All of these topics are important and certainly help you understand the adolescent patient better. However, with time for visits being limited, I and many of my colleagues use the third S to assess strengths. Why is it important to talk about strengths? Well, much of medicine is focused on finding out what's wrong with a patient. While it is important to discover if a person has a disease or risk factors for a disease, medicine is also moving more to health promotion and wellness. In adolescent medicine, we like to talk about positive youth development. We know that young people face many health risks. We want to support health-promoting decisions whenever they occur. You may have already heard about adverse childhood experiences, ACEs. If you haven't, we will talk more about these in a future video. Briefly, children who experience childhood trauma are more likely to have health problems when they are older, aka adults. Researchers are now also looking at positive childhood experiences to understand protective factors for youth, especially those who have had adverse childhood experiences. Many young people struggle with their self-esteem. Taking a moment to identify their strengths can help build their self-esteem and change their outlook on life. The American Academy of Pediatrics has recommended using a SHADESS assessment instead of the SSHADESS assessment, and starting the psychosocial interview by asking about adolescent strengths. I prefer to end my one-on-one time with an adolescent talking about strengths so that we end on a positive note. I encourage you to play around with the different interview techniques and find the style that works best for you and your practice. Here are some questions I like to ask patients to assess their strengths. What are 3 things that you do well? What are 3 things that are fabulous about you? If they're stuck and they cannot think of anything, I might ask, what would your best friend say they like about you? What would your parents or guardians say are your strengths? If the patient really cannot think of anything in the moment, I get a little concerned about them and their social supports. I make a mental note of it and often choose to follow them more closely if there are other health risk behaviors. I also usually offer my own observations of what I think their strengths are. Teens are great BS detectors, so I only make statements that I truly believe, and I encourage you to do the same. We have officially wrapped up the HEADS assessment, including the extra S for strengths. As discussed, you can perform the psychosocial assessment using HEADS or SHADESS or your own mnemonic. The key thing is to remember to do it and to follow up on any concerning responses. In the weeks ahead, we will continue to explore other topics in adolescent medicine. Next time, we'll talk about one of the other optional S's, sleep. Thank you for tuning in to our video. We would love to hear your feedback and ideas for future videos. Please send us a message through this platform or directly through our website, www.adolescentmedicineconsulting.com. We look forward to seeing you at one of our free monthly Zoom sessions. These sessions are held on the second Wednesday of the month at 8 p.m. Eastern. You can get more info about the sessions at our website or in the text box accompanying this video. Thanks again from Adolescent Medicine Consulting, where we help you help teens.